the FFP3 respiratory masks that we have released for use today from the central stockpile that First Minister mentioned. Those masks had expiry dates of June and August 2019, which is why we had not released them until now. We had them independently tested in order to ensure that they remained safe and valid. That testing has been supplemented by the view of the Health and Safety Executive and our own HPS and our Chief Medical Officer, and also has the support of Dr. Miles Mack, who is the Chair of the Academy of Medical Royal Colleges and Faculties in Scotland, all of whom assuring that these masks are safe to use, and they will be now issued across those parts of our health service where there are the appropriate masks as protection for staff for them to use. In addition, as everyone knows, we are paying very close and detailed daily attention to the overall stock of PPE for our health and social care staff. We are now have now taken over the ordering, supply and distribution of PPE to social care and care at home staff, and are looking daily at not only the ordering but also what is in the pipeline. As of today, we have no shortages in those areas. We are increasing the distribution routes and networks in order to ensure that the supplies that people need get to where they are needed across the country, including in our remote and rural areas, as quickly as possible. Because as FM and indeed the Chief Medical Officer have said, and I too repeatedly, the safety of our health and social care staff is of absolute critical importance, and so we are taking every step we can to make sure that they have the equipment they need as quickly as they need it, and that we have orders in the pipeline to ensure that stocks are consistently replenished.
Okay, thank you, Cabinet Secretary. Sarah. Thank you, First Minister. Once again, we've seen the number of confirmed cases in Scotland rise, and very sadly, the number of deaths again has risen. As I've said before, this, of course, is a very significant underestimate of the number of cases in Scotland, and we're probably looking at of the order of perhaps 40 to 50,000 people in Scotland who are now infected with coronavirus. Many of them don't yet know that they are infected, nor indeed do they realise that they are potentially going to infect those around them. It's been very encouraging to see the empty streets and the empty shops and the empty transport in Scotland. This is going to be a long haul, and I just encourage people to, as the weekend comes, a weekend perhaps unlike any other you've ever experienced. The children are already asking if they can go back to school because they miss their friends and all the fun that school can bring, as well as the hard work. But as we approach the weekend, to not relax those rules, to not be tempted to see other families from other households, that combining yourself to your own household, to not mixing with other people who then are mixing with others, is so key and so important. And I'd thank those who have been able to do this so far, but really just encourage, the virus is out there, you do not know who has it, to stay away from as many people as possible, stay with your family, stay with your household. Please do get out and exercise just once a day. That's very, very important for all of us too.
Thank you. Can I open to any questions? Mark.
The questions, first of the Justice and then the Health.